Women's health is finally being taken more seriously. But what is the next horizon, and how do we ensure that this progression remains central to designs and inquiry going forward? We speak to 4 female designers. Antya Waegemann, founder and CEO of Margo Health, Malene Hegenberger, midwife and inventor of Hegenberger Speculum, and Dr. Sara Saeed Khurram, and Dr. Iffat Zafar, CEO and COO of Sehat Kahani, about designing to improve life for women and how this elevates us all.
Hello, everyone, and welcome to our Woman is the Word event. My name is Ditte Ravn, and I'm communication and community manager here at the Index Project. Today, we're going to take a deep dive into a trend that focuses on women's health and women's well-being, something we saw that was quite prevalent in this year's Index Award finalists for the 2021 Index Award. And the funny thing, I guess, about this is that we, of course, see that this is a booming trend that many has been asking for and needing. And in some corners of the world, the focus on women's health has become a worrying tendency, unfortunately. And not that long ago, WHO took the temperature on women's health and well-being globally. And I just want to share some of their findings for you guys. Because it's a good explanation of why I think we still need to talk about these things. So today, currently, over 800 women still die every day in pregnancy and childbirth. There is violence against women is still very pervasive, and it's affecting 1 in 3 women globally. And we have 70% of the health and social sector being made up by women. But still, we see very few women in leadership positions, and we also see them getting paid less. And finally, depression, mental health issues like that are twice as prevalent among women as men. And in fact, we have 3 designers here today with us who are addressing these issues I've just explained. And I'm going to do a quick introduction to them, and then you're going to hear about their wonderful Index Award 2021 finalist solutions. First of all, we have Dr. Iffat Zafar, who is the COO of Sehat Kahani, which is a health tech company that is bringing doctor brides, which you will explain in a little bit, into the workforce. We also have Antya Waegemann, who is the CEO and the founder of Margo Health, who is behind the Margo kit, which is a redesigned sexual assault kit. And lastly, we have Malene Hegenberger, who is a midwife and inventor of the Hegenberger Speculum, another critical redesign of a over 150-year-old medical tool that definitely needed an upgrade. But we'll start now with some presentations. And Iffat, if you could tell us a bit more about Sehat Kahani.
So good evening, everybody. Thank you for giving us this opportunity and this platform to present. My name is Dr. Iffat Zafar. I'm the co-founder and COO of a health tech organization named Sehat Kahani, based out of Pakistan. And Sehat Kahani means story of health. And this is an organization that me and my co-founder, Dr. Sara Saeed Khurram, built. And I'll briefly talk about it. So when you talk about healthcare in a country like Pakistan, there are 2 things that are the major challenges. The first challenge that we always see is that it's a country with a population of 200 million plus people. But because of the social and cultural norms, more than 50% of our population lacks access to quality healthcare. And while there are multiple reasons for it, the major reason that we foresaw as a design flaw in the entire healthcare ecosystem in Pakistan was that around 12% of physicians leave Pakistan for better opportunities outside of Pakistan. Out of the doctors that are remaining, around 60% of them are female physicians who do not practice because of social and cultural norms, which results in major healthcare disparities. Pakistan still ranks 154th out of 195 countries in terms of healthcare access. We still have the highest ratios of breast cancer, child mortality, maternal mortality, and so forth. And that's when we came with our solution. Our solution revolves around engaging female physicians who might not be working to their full potential and engaging them in provision of healthcare using telemedicine platforms. We do it in two ways. This is the entire map of Pakistan. And for those people who belong to the low income or the rural communities, we build nurse assisted telemedicine clinics. In 2017, we started the company by building these nurse assisted telemedicine companies. And in 2019, we also realized that healthcare is a challenge for people like you and me also. So if someone who's a city dweller, an urban dweller, how does he access healthcare? That's when we developed our mobile application. The mobile application allows access to any person, no matter where they're based out of, from their smartphone. It has a retail market as well as corporate market. So you can just go on the Play Store, download it and access services. It also has a corporate version for all of those employees who are trying to access healthcare through an account which is paid for by your employer and not necessarily by you paying yourself out of your pocket. As I mentioned, we started in 2017. As of today, we have 35 e-health clinics in 4 provinces of Pakistan. We're actively working with 753 corporations. We've successfully conducted 550,000 online consultations with around 250,000 plus downloads. And the total beneficiary base that we are providing this service to is around 7.2 million lives. Our doctors include physicians from Pakistan, but also all over the world. So they could be based in Australia, in China, in Brazil, in US, in Canada. We have a vast variety of the opportunity that this gives to all those physicians who want to give back to Pakistan. We have been catering to all kinds of primary healthcare challenges, maternal healthcare challenges, also mental health issues. And we cater to both males and females. We've actively worked with the government in the COVID crisis, which really identified the need and the importance of telemedicine during the COVID crisis. If you talk about design, I think during COVID, the right applicability of a telemedicine platform for individuals and beneficiaries came forward. We also actively work in the mental health arena, where not only do we work in communities, but we also work for a mobile application, whether it's a retail or a corporate. Anyone who wants to access mental health care services can also access it. We got the opportunity to meet and present our work to the President of Pakistan this year. We are also an organization who has proudly raised investment in the last few years through both various donors, international partner organizations, as well as through equity investment. In the next 5 years, we want to enhance the overall design of our application by integrating AI and ML into it, by catering to preventive healthcare, by enhancing our physician network, and also going into territories and geographies where healthcare is definitely a need. This is about Sehat Kahani, and this is our story. And we would love for all of you to be a part of our story.
Thank you so much, Iffat. I think just following from when you became a finalist as well and being introduced to your story of health, I think it's amazing how much you've grown in such a short time. Of course, we have COVID-19 also bringing a need for telehealth medicine, but just to see the impact you have made in such a short time is amazing. And on that note, I want to go ahead and let you, Antya, tell us a bit more about Margo Kit.
Absolutely. So I'm Antya Waegemann and very excited to be here as well. Let me switch gears. So I do first want to give a trigger warning that I will be speaking about sexual assault and domestic violence. So what you see here is something that women all over the world fear. And this is a fear of violence, a fear of rape, and worse, this is a fear that's generally accepted everywhere. And I want to highlight that this is something that happens to women because when it comes to sexual assault, studies have found that around 90% of victims are women and around 90% of perpetrators are men. And so when I began studying at the School of Visual Arts in a master's program for design, I was really heavily weighed by these statistics. And at the time, it was 2017, and so the Me Too movement had just captivated the entire world. But I heard this horrifying statistic that there were over 400,000 untested rape kits in the US. And so it really became clear to me that crimes against women are treated differently, not just in the US, but all over the world. So as a designer, I immediately thought, what if we could fundamentally transform the system of reporting and collecting evidence for gender violence victims through design? And I spent about a year researching and interviewing social workers, victims, healthcare providers, police to better understand how the current system got to where it is today, and also became a sexual assault and domestic violence advocate at a New York hospital, where I essentially became a first responder myself. And through that experience, I really learned that the process is far worse than I could have ever imagined, and this is especially true for victims, and there are so many of them. Because in the US, someone is sexually assaulted every 73 seconds. And of these thousands of victims, only 30% choose to report their crime. And choosing to report is typically getting a sexual assault evidence kit, which is commonly known as a rape kit. And it's generally a box that includes many envelopes with evidence collecting tools and then paperwork about the crime. However, these kits are extremely inaccessible and disproportionately available to whiter and wealthier neighborhoods. And there were even stories of women who had to drive up to 5 hours to multiple hospitals just to find a place that would have a kit. And so through my experience as an advocate, I also learned that someone who's incredibly important within this process is the healthcare provider. And the current system and the current kits are really designed for what is called a sexual assault nurse examiner, or a SANE nurse, who go through extensive forensic training and trauma-focused training. However, these nurses are only available at around 20% of hospitals in the US. So what that means is the majority of the kits are being collected by healthcare providers who may have never even seen a kit before. So imagine that you're collecting evidence for the first time as a healthcare provider, and you see this kit here for the very first time. These kits are so incredibly taxing and confusing for the healthcare provider that completing all of these envelopes and steps can sometimes take anywhere between 2 to 10 hours to complete. And so after these kits are collected, they're then typically brought to the police who manage and store them. Sometimes they're brought to the lab and tested and then brought back. So when I was talking about someone being sexually assaulted every 73 seconds and these thousands of victims, many of them go through this entire process and have absolutely no idea what happened to their kit, don't know if it's tested, and worse than that, less than 1% of cases end in any conviction. So throughout my master's thesis, I designed 6 different products that you can see here that really tackle all of the different problems throughout this process for victims and first responders. And they've all come together in what is today called Margo, an end-to-end product and service that improves reporting gender violence crimes through a redesigned rape kit and integrated digital platform. Margo stands for Martha Goddard, who was the first inventor of the kit in the 1970s, but she never got recognition for her invention, and it instead went to her male counterpart. So Margo's platform makes it easier for victims to find help and to start to document their case. The redesigned kit and tools, as well as instructions, make it easier for the provider to collect evidence more efficiently and in less time. And then potentially most important, from that, is that the victim can follow along in real time. So rather than sit in the hospital without any idea what to expect, they can scan different parts of the kit throughout the process, and they can take control of the exam. They can vocalize what parts they want to participate in and what they want to skip over. And this creates the first unified system where police, victims, and providers can all manage the case and track the kits in one place, allowing for more collaboration, transparency, and accountability. So we've partnered with various organizations, including the International Association for Forensic Nurses, who create standards for the kits. We won various awards like Fast Company's 2020 World Changing Ideas Award. But during these 5 minutes that I've just presented to you, I want to remind you that 4 women have just been sexually assaulted. So my hope is for Margo to truly transform gender violence reporting so that women around the world can finally seek the justice that they deserve.
Thank you very, very much, Antya. I think I've seen it before, but every time I see that video of the woman pulling out the stuff in the old former sexual assault kit, it's just mind-boggling that it's been like this. And I think it's really interesting that you've done this redesign. And we're of course gonna dive into the many aspects I think there is to the design as well, both for the worker, but also for the patient itself. And I know that this worker-patient benefits is also applicable to Malene's invention, the Hegenberger Speculum. So Malene, I'll hand it over to you so you can tell us a bit more about that.
Thank you so much. I'm just going to share my screen here. I hope you can all see it.
Yes.
All right. So thank you everyone for having me. I'm Malene Hegenberger, Danish nurse midwife. And it's always a question how many women need suturing, because this is a big surprise for a lot of people. And it's actually 95% of the first-time moms, and then it's 69% of the multi-parent, I mean, the women who have more than one baby. So it's a huge amount of women, and something that people are not speaking about because there's so much taboo about this suturing and the side effects after a poor suturing. So the challenges for the patient when it comes to suturing is that it usually takes a lot longer than most women know. It takes between 30 to 60 minutes, either in labor room or in the OR. And the procedure can be very unnecessarily painful for the patient or the women. And the procedure disrupts the first hours between mother and newborn. And the most important part is that an incorrect diagnosis or a poor suturing or repair that can really have lifelong consequences for the women. Something that is very difficult to talk about for a lot of women and also clinicians. The challenges for us as clinicians, I'm here in labor ward right now, I sutured 2 women this morning, is that the procedure is associated with really bad, awkward working positions. We sit really poorly at all times of the day. It can be stressful to work with a patient. It's pain that's awake. In other surgical procedures, the patient or the woman is usually asleep, so the surgeon can focus. And then a correct diagnosis can be challenging, especially if you are unsure or if you're in a busy department, you can't get help. And then, of course, there's an elevated risk of needle stick injuries because it's difficult to suture in this soft tunnel organ that we're dealing with. And then in most cases, we need an assistant to hold aside, which is also the whole background about my invention. These are pictures from suturings in different departments. This is what it looks like on a global level. I'm sorry if this is scary to look at, but it doesn't matter which country you're in. If you are in a high income country or in a low income, when it comes to suturing, we all go back to this procedure the same way. We separate with our fingers, we suture with local anesthesia with a needle holder and a suture, and it's a very poor area within labor delivery. There's a low focus on this, there's a low prestige in this, but it's something that should be changed, that should be done a lot about. These are the speculums that we've used for so many years. It needs an assistant to stand and hold, and it's not really made for the female pelvis. This is what I have made. It's made more organically. It has a more female pelvic shape to it. It's soft, it's silicone, and the women are not afraid of it. When it's placed, it sits still, and that means we can actually see what we're doing. I will just repeat that. We can see what we're doing, which is really important. And there's much less pain for the women. So less pain for the women, much better vision for us, equals better female health care for many, many years. This is how it works. So it's actually folded together and then you slowly place it. Of course, these pictures are a little animated, but it's folded, placed in there, and then it sits still, which creates a much less traumatic experience for the women. And for us as clinicians, we can see the tear, which is, well, that's what you would like to do when you do surgical procedures. And we can actually suture with correct suturing technique. That means we don't hold aside with our fingers. We use a needle holder and a forceps. There's improved suturing technique, which I think is very, very in the interest of women. We see how much tissue we actually get on the sutures. And then there's much less needle stick injuries, which every clinician out there knows how very annoying that is. You have to go to the ER, etc., etc. And then the biggest improvement is that we can teach the young midwives, the young doctors, we can teach them really well so that when they get out of school, they have good clinical skills. Every midwife, every doctor is going to be suturing hundreds, if not thousands of women. So it's all about training them. I've just been teaching 2 clinicians here today. If we get them good off the ramp, we have very good clinical skills. You know, teach them as if they're going to suture yourself tomorrow. And if they can see what they're doing, then they learn much, much better. The solution, the benefits for the women is there's much less pain during the repair. We all love that one. We don't want obstetric violence. We don't want those traumatic suturings. Those times are gone, in my opinion. We want much less suturing time. We want a quicker reuniting of the mother and the newborn. And then we want a much, much better diagnosis, a correct diagnosis, so that a woman doesn't have to come back 6 and 8 weeks with side effects or poor repair. So these are traditional teaching situation. It's slow, it's painful for the women, it's difficult to see, not optimal learning, and it's not optimal treatment of the women. This is what we want. We want teaching like this. We want suturing like this, where you have an optimal view of the tear. We have very improved ergonomics for us as clinicians. We have a positive training, competent clinicians. We want much less pain for the women, and better suturing for all women. Or we as women, we simply deserve this. And less manipulation, less pain, and less fear when you place the speculum. I mean, the woman has to be able to relax. She has to be able to lie with her baby, and the suturing should not be traumatic, and I should be able to do my job. I get much less stress if I have a patient that's comfortable and relaxed, and the suturing goes much better. It's so important within female health. She has to leave the hospital with a good birthing experience, a healthy baby, and a pelvic floor that works. That is optimal. So my ergonomics is important. When I suture with the Hegenberger speculum, I have my shoulders down. I have less strain on my wrist and my shoulders because we work 24/7. There's a big difference between suturing at 8 a.m. in the morning or 4 a.m. in the morning. Big difference there. And I can see the tear, and there's much less needle stick injuries. The OR nurses, they love it, and that's the ergonomic of it as well. They don't have to stand. You can see the speculum on the table there. That's the old-fashioned one. It looks like something you could build a house with, but you need somebody to stand and hold it aside. It is not optimal. And then we have optimized training. We have better clinicians. We have improved technique. That's better diagnosis. We have better correct suturing. That's better result. And we have invested in a much strong and lasting female healthcare. These women are going to live with these sutures for a very long time. They're going to have an intimacy life for a very, very long time. So that was all for me, and I hope I made it by the 5 minutes.
Yes, you did. You crammed a lot of information in there. That was really, really great. It was interesting because I've of course also researched your speculum, and the whole learning part of it as well was a bit interesting to hear as well. Of course, yeah, bringing it on to other new clinicians as well. And also interesting that you just came from 2 surgerings this morning. We're talking to people who are very much in their field working, and Iffat is also as well. So she will be, she is at work, so she will be joining us when she is able to. But we'll start the conversation right now. I have a question that really, I think, fits well, especially with what you two have been doing with the Margo kit and the, what is it called, the Hegenberger speculum. Let me start with you, Antya. Why do you think it took so long, this Margo kit, like to think of a redesign of this?
Yeah, I think that generally, you know, it's something, unfortunately, that sits a little bit more in the government. So because it's evidence, even though it's interacted with many different people, it's really something that the government sort of holds control of. And often that is a place that really doesn't get as much innovation, I think, as other areas. So I think that's one aspect of it. On top of that, I think that, you know, the Me Too movement really did help bring to light what a problem sexual assault and especially domestic violence is all over the world. I think we're still in a place where we're still learning to believe survivors. I think we're not quite there yet. And so I think the closer we get to understanding that these women have had a crime happen to them and that these men are in fact perpetrators, the more we'll be able to accept these sort of innovations that really help improve the lives of these women.
And same to you as Malene. Why did it take so long for a 150-year-old medical tool that's not been working that well? It seems like why now? What happened?
I think that there hasn't been a lot of prestige around it. It's something that should just be done quickly and wrapped up. And then with the times, with the years, the modern women have been more. And I agree as well with the So Me campaign that more and more women have actually felt that it was okay to say no, or this is not great. And there's been, within my field, there's been an increased awareness of poor suturings. And there's also been an increased awareness of the problems that women come home with. And they have, just like any other taboo with rape and things, it's always only the tip of the iceberg that you see. And when suddenly that starts to be spoken about, then you realize how big a problem it is that women have actually been silenced about this for many, many years. And that put a responsibility to us as professions to increase. But there hasn't been any prestige in suturing on a global level. It's been about getting the baby out and stop any bleeding. And then whatever there was left to do, you just wrap that up. There hasn't been any focus on life quality for the women afterwards. And it's very different from country to country, how focused you are, how you train this, but it's all comes down to that the female pelvic health or the sexual health has had very low prestige, just like rape has so many victims, I'm sure, out there have told their story and not been listened to, or and it's the same with women in my area. They have told that they have pain and they have been placed in the category of being hysteric or what can you expect after giving birth, and so it's always been put back to them as it's either their own fault or they you have to live with it. This is the price of getting a child. And I don't agree with that at all. You would never do that with any other surgeries. So it's going to be my job it's going to be my passion to bring this out. And the delivery is far from over just because the baby's out and mom is not bleeding. She has a pelvic floor, 3 organ function. It's the urine, the vagina, and the anus. Those are 3 essential body functions that she has to live with for the rest of her lives. And that has to be checked and inspected properly.
And I think another thing just to add quickly is that, coming from a design perspective, so many things in our life everywhere in the world is really designed for men. Very few things are researched or tested for women. And so I think, I know this is kind of trickling into another area, but I think there are just so many other things that can be designed for or redesigned that really apply to women.
So, Malene, I was asking you about that you, and also for you, Iffat, as well, you're both trained in the medical world, and then suddenly you see this problem and you take the leap of becoming a solution maker. And I just wanted to hear about that, a little bit about that process. So if we start out with you, Malene.
Well, it's interesting because I started out thinking that I was the only one who had these problems viewing the tear and suturing and creating a view. And then when you speak to other clinicians, we all have the same problem. So based on my clinical skills and my experience, my work experience, I had a very clear 3D image or a 3D need, if you can use that word, of what I needed in my own situation in the clinical field. And based on that need, and I know that the shape of the vagina and the pelvis, I had a kind of quite quickly, I had a picture of what I would need and what would be. And there's also that thing about putting empathy into your design. So, I mean, not only my needs, but also the needs of the patient or the woman. There's many ways to create a view. There's many tools you can put in there, but something that also fits her and would be less traumatic, less painful for her. So it kind of that's synergy between my needs as a clinician, but also who's going to be using the tool, who am I going to place the tool on, and what kind of situations are they in? When you're just giving birth, you are in a different mental state, just like in other situations of life, but it is extreme tiredness and happiness and exhaustion, and in some countries it's dangerous, and it's so it has been a very, very interesting and rewarding process to speak to other midwives and women who have gone through really traumatic suturings. It's been so interesting to dig into that field. Very new to me, but it's been a true pleasure that people have been sharing their stories with me, and both clinical stories, but also patients or women with suturings. how we can improve. How can we improve based on their needs and my own needs?
And that's, I think, speaking to other people in your profession is also something you must have done a lot, Iffat, to see that there was a problem here with this whole field of women who have educated doctors and just don't have the space to work because there are expectations for them to do something else. Could you talk a little bit about your journey from being a doctor and to now being COO of Sehat Kahani?
I think in Pakistan, there's, and in a lot of South Asian countries, there is a culture that women are not working that avidly. So when a girl is growing up, there are very limited professions that the family approves of. So medicine is one of those, teaching is one of those. And when you become a doctor, at times the perspective that the parents, or at times the parents of men have in their mind is that okay, they'll get better hands in marriage, unfortunately. So that's one major challenge that happens, and that happens with a lot of patients, a lot of doctors. If I talk about in my scenario, even my co-founder, Dr. Sara, who really wanted to join today, but because her father sick, she couldn't join the conversation. She had to go through this entire phenomena where she ended up marrying, and when she got married, she had to shift to another city, and because of shifting, she couldn't continue her practice in the regular clinic that she was doing. And then she started to do call consultations, and then they turned into a video consultation, and that's how the concept came forward, that how can we engage patients through a video call. And it's not just the problem of the doctors. If you look at the communities, we have such large communities who don't have any doctor. We have communities where quacks are working, where nurses pretend to be doctors, where you can't imagine the kind of dynamics that actually exist. For example, in one of the communities, there was actually a school guard who was actually working as a doctor. And the community is unfortunately so illiterate. They lack education, they lack information. Most importantly, they lack access. Even if they find out that the other person is not a doctor, who do they go to? And that has been the biggest challenge. And I think through the advent of telemedicine, both these challenges have been met. So not only are now doctors being employed, communities are also gaining access to healthcare. So it's more like a win-win situation for both.
And I think that's a really, really good point to make, that this is, of course, also not only helping a workforce, but helping communities. And I think that's actually something that is incredible about all of your solutions. It's changing a workforce, but it's also making a difference for patients. In your presentation, Antya, you talked about being a designer, and I know you've formerly looked into a lot of environmental issues and urban planning, and then you saw this statistic you mentioned and was like, oh, I need to do something about this. And I think this is a situation that's pretty interesting, because I think a lot of us see statistics, or we see something that enrages us, but you actually stepped out and did something about it. Could you tell? And then you actually went in to become a sexual assault advocate at a university and do your research there. Could you speak about this kind of like leap that we all wish, I guess, to take from just seeing there's a problem and actually trying to solve it?
Yeah, so I was working in essentially sustainability and urban planning, and I think I was really drawn to that because it was looking at really complex problems. But within that space, you often don't actually get to solve the problem. And so once I kind of transitioned into design, I really fell in love with this idea that design could really change things. And you can certainly, even see that with Malene's design, that, once you have something in your hands, once you can show people like, hey, this is better, this is making this process better, you can change things so much faster than you can, say, with policy or any sort of research. So that was really exciting to me. And I think that just generally, I'd say I was raised by like a raging feminist, and I've always been really upset about it. And people always ask, like, why did you do this? And in many ways, it kind of upsets me, because I'm like, are you okay with what's happening? Because, like, why are we okay with it? And to me, it's just kind of a no-brainer. Like, we have to do something about this. We have to change it. It's not acceptable. we can't listen to the news again and hear about, you know, women of war being raped. We can't listen to people about, or listen about stories about women down the street that are being raped and nothing's happening, because essentially nothing is happening anywhere. So it was just sort of that really made me feel as though understanding that design has such an impact on the way that we interact in our daily lives, there has to be a way that it could come in and change this process and transform these injustices that are happening. So I'd say that was the major kind of excitement to move into the space. And then I think from becoming an advocate, it was something that really starting to research, I knew I would never understand what it was actually like until I saw it firsthand. And I think becoming an advocate was such an incredible experience, because you do really learn that the process is so much worse than you ever imagined in every way possible. You interact with the police, you see all of their biases and their prejudices, you see the way that they treat victims, you see the way that often hospitals and doctors treat victims really poorly. And the fact that you have to even have an advocate, a volunteer who takes the time of the night of their day, you know, they work full time, and then at night they volunteer to spend 11 hours in the hospital to be there for victims because the healthcare system and the police can't be there for them, I think shows also a bigger problem that, you know, these are things that need to be designed into those processes for these people so that there don't have to be volunteers coming in to sort of show that empathy and redesigns for the victims.
Great. That was really, really interesting to hear that whole like process in detail. And I think something you said really stuck with me, like people around you saying, why did you do this? Why did you make this? And I think it would be interesting to hear, just because, as I said in the introduction, this is still something that could be controversial in some areas to design for women. So I would just like to hear if you want to share what's been the reactions in your professional community or your personal, if you feel comfortable sharing that. What's been the reactions to you making this design from the professional community? Iffat, maybe you can start.
Yeah, I think it has been an interesting journey. So while, you know, the women love us, the female physicians just absolutely adore the idea. We've come across, honestly, a lot of husbands who have this notion that, oh my God, my wife wasn't working, but now because of you, she has started to work. So, you know, at times there are families who are not very supportive of women working, and unfortunately, it's more like a control factor. They feel that a woman who's not working, who's not financially independent, is somehow within my control. And, you know, we've come across so many men who have had this weird notion that, oh my God, now my wife works with your organization. Now she's earning money. Now she's independent, you know. Even though she's home, she has her own, you know, pocket now. So that has been an interesting finding that we have seen. A lot of times, some people have tried to put the word out there that, oh my God, these are all female doctors who perhaps are not working anywhere else. So what's the kind of quality they might have, you know, just so that there's a bad element associated with it. But I think over time we have overcome with our, you know, strong presence in the community. And, you know, as you said, and, you know, as we all know, it is all about design. In communities, we have done so many patient perspectives. We have so many research groups, focus groups with women, with men also, trying to understand what are their main problems, what are their main challenges. And I think that has been the biggest growth factor for us. That has been the factor that has helped us become acceptable to this extent that, okay, now they all know that if this is a service that I want, for example, initially we just used to do telemedicine in community. Then we realized women can't even go for an ultrasound because they're not allowed to do so. They can't just go out of their place, travel to a vicinity, get their ultrasounds done. And how can we have this ultrasound facility in the clinic now? And now they have this one-stop shop solution where everything can actually be done. So I think, yeah, this is how we've tried to do it.
Yeah, and it's very much like the proof is in the pudding. You are helping communities, so you are showing what your worth is, right, through the actions that you're doing. Maybe you want to take over, Malene, on that question.
Yeah, I think the question was what our surroundings was thinking about the product itself, right?
Yeah, exactly.
Yeah, I think well, my product is a little bit you can say specific to the clinical world, and it's not the first thing you bring out at a party, but it's certainly when you speak to other clinicians, there's a very open dialogue around it, and I must say it's a really nice product to bring out to departments, because we all struggled with this for the last, God knows, 15 years, 50 years. And people, the sentence I hear the most is, why haven't we had this for the last 50 years? Why haven't anyone developed this? Because it's so simple and it's so intuitive when you see it. So I think that in the professional world, it has been a really nice product to bring out. And then when you speak to women or people out in the outside of the hospital or the clinical world, then it's first it's a lack of awareness of how many women who need suturing. But then when you speak to women or you speak to men, then if you within 30 minutes or usually 40 minutes in the conversation, then usually you get a private story, or you get everyone can relate to this. Even the men can relate to this, and maybe I remember when my wife delivered, they were suturing, or I remember when my sister, she had her baby, she had a lot of trouble. So it's something that takes a little bit of time for people to speak about, but when you gain their confidence, it's something that they open up about, and everybody can relate to this. And it also goes to the men, they are so worried about their wives or whoever, if it's a partner, but it's just everybody has an awareness that something can happen during delivery, but we don't speak about it. We just hope for the best. And I think it should be addressed. There should have so much more focus. And it should have a much bigger place in the delivery, birthing, preparation for birth, and also the training of clinicians. There should be so much more focus on this, so that when you come in as a woman to a hospital, you know that this hospital is well trained. It's not the part of the delivery that they skip over quickly. It shouldn't be that women are choosing the cesarean section over a vaginal birth because they're afraid of tears. And I think 8 out of 10 women, it's the first thing they ask about when the baby's out and the baby's well. That is, do I need suturing? It is so typical. And I think we are frozen now again. Is that correct? But it's a very important part of it. And I think it's been a really nice product to bring out and to spread the word with, because it's needed both for us as clinicians, but also the women. The women totally get it.
Great, thank you. Jon, can you just give us a quick update? All right, then we'll just move along. So I was thinking of this thing you said, Malene, with the whole, I just lost my train of thought here, but this whole idea of relating it to a personal story, which I think is in many ways the way that we can move design forward, that we can make awareness about our products, is that finding these personal connections to the people we are designing for, also kind of like coincidentally designing for the men in this case. I think that's actually really interesting. Antya, maybe you wanna also, you shared a little bit about like, why did you do this? But what has been the reaction from the workers, for example, or some of the victims you have interviewed?
Yeah, I'd say that generally victims and the public are extremely receptive and excited and feel as though, it's a long time coming. I can't believe that we do this to anyone who's experienced sexual assault or domestic violence. I'd say the healthcare world is a little tricky. I'd say it kind of goes both ways. A lot of people are really excited about it, and some people are very skeptical. So I think it's generally been a journey, because I think from the healthcare and the government side of things, I think there's a bit of a fear of change, of having to introduce something new, change the processes, kind of admit that the way things are right now isn't great. And so I think that is certainly an obstacle that we're figuring out how to overcome. And from a funding perspective, I think it's a whole different ballgame. Typically, investors are men, and while I think men understand the capacity of what has happened, there's, I think, a little bit of fear too that is Me Too going to happen to me? And I've even gotten questions from male investors that are like, why do we need this? And so I think there's still a really big lack of understanding from male investors, and from the system is still incredibly patriarchal. So there's some barriers there, but I'd say generally women are very excited about this. I get really great support from them. There are, of course, men who are extremely supportive as well, but it's a little bit more of a tricky barrier to overcome.
Yeah, I bet that it's not really a focus in that sense still for a male, unfortunately, maybe from a male profit-oriented perspective per se. I have a question for you guys that it may be big, but I think it might be very, very useful for those watching out there, because I think what I really been my key takeaway from having you guys here today is just like taking the step to make a solution for a problem that you're seeing, and doing it for women, and doing it in a field that is very much, I feel awful saying that it's kind of like a trend, but it is because in a sense it's still not the tradition to design for universal accessibility for women and all this kind of things. So I was thinking, for the designers watching out there who want to design and make solutions for women, what is your tip for those guys? Maybe Antya, you want to start?
Yeah, I think first of all, it's exciting. I think there's so much territory left that we can continue to design for. So I think that's really exciting. I do think, as you were mentioning, it's becoming a bit more popular from both just general reception to investments. And so I think that's also, definitely a motivation and an exciting space to get into. I think, definitely my advice would be to find a real problem that feels like it can have a solution, potentially that is tangible, because people are able to better understand it when it is like a real existing problem. And then I think there's so much opportunity. I think also stick to that. I remember hearing about a woman designer that I met who redesigned something for women with health issues, and it was so wonderful because the research was only ever done on men, and then her product was bought and they made it for men after that. So I want to say stick to it. Don't let it shift from the focus on women, because there's just so much opportunity out there.
Yeah, keep protective of what you're doing is a really, really good point, I think, because it might be easy to take the easy way in a sense. Iffat, you're here with us again. Do you have any tips for young designers who want to design for women? What would you say to them?
So I think I'll talk about two things. When you talk about women, especially in a developing country like Pakistan, you need to understand that there's a lot of, centuries old built patriarchy. You need to break that. If you talk about products, for example, very basic things which give a woman comfort. For example, in my telemedicine app, you have the opportunity to start off with a chat conversation, then have an audio. And if you want, you can go into the video conversation, because not every female in Pakistan feels safe switching on the video in the very first instance, especially if you're speaking to a physician whom you haven't met ever. So, just taking care of very small things which cater to the woman. I think another thing which is very important when you are developing something, especially when you talk about the service industry, for example, healthcare, the area that I work in is, the service industry. how can you be more female friendly? As an organization, when me and my co-founder, we were raising investments, I think the biggest challenge we had was that there's no leveled playing field. I have to make sure that my children go to school, they're fed, the nanny is there, or if the nanny is not there, for example, I have to take care of it. But most of the men don't have to face those challenges. So, for example, a lot of investor conversations happen at dinners, at late night, meetings, events, which as a woman at times I just can't do because I have to put my kids to sleep. I have to make sure that they're well fed, they finish their homework, they have to wake up in the morning. So at times I just feel that this challenge is so much there. It is different in some parts of the world where both the parents take responsibility. But for example, in my part of the world, most of the responsibility unfortunately falls on the woman. So I think you also have to start changing how the playing field is being built. You also have to start being more inclusive of women if they have challenge. I think one thing that has come out really positively with COVID, for example, is that a lot of conferences, even for example, this conference was possible even in a remote manner. I think before COVID, having online conferences, events was not the norm. So I think now things are moving in the right direction. I think we just need to accept, that women will have families, they will have children, but they are also very ambitious. They want to work, they want to really deliver, and just, creating that village which can support. I think these are my 2 cents.
I think that was very useful. So it's like the small details, really thinking about the user when you're designing. And also this, I think, which was really a good point to make, this level playing field and being aware of this, both as a woman ourselves, but also for those of you watching who are maybe looking to help female innovations move forward. This level playing field, I think, was a really good point. Malene, how about you?
Well, I think I hope and I believe that the women, the young women who are coming or who are here today are a lot more outspoken, and based on their more openness, they are more articulate about their actual needs. What would make life better for me? Because we are not really that good at explaining how we feel and talk about the difficult, the sensitive things. But the more we are able to talk about that's sexual health, that's how we feel about our body, trauma, all these things, the more the designs can actually be improved, because the more we know about what's going on in the people who are going to use our designs and our products, how they really feel and how we can actually make the whole experience, the treatment better. We need to understand them, and to understand them, they need to be open and speak to us about their truly needs, and not to please us, as clinicians or designers, not to say what they think we want them to say. And I think that has taken many generations for women to actually be honest and say, no, it doesn't feel right. I did get raped, this and this, I need to see a doctor, and that we actually get much better at saying what we truly need and how we truly feel. I think that it will improve the future designs, because we will actually know what to design for. Does that make sense? I hope so. If we have women who are very quiet, who are pleasers, who are saying all is good, we can't be innovative. We might get a sense of the problems, but we need that truth from the recipients of the products or from the users. And I really hope and I believe that the future women will be a lot more outspoken, and they will be a lot more open about how they actually feel and how we can improve our treatment of them, and design our products so that they fit into the female world. And it's just like what was said before about that most of the things are designed by men, and we need balance in that. But we also need to understand the women who are going to use our products, and we only understand them really truly by them being honest and more open to us. But I believe the young women are going to be much more stronger in their verbal appearance, and also much more honest that things are not always great, and we are not supposed to be good little nice girls for the rest of our lives. We do have problems that has to be solved, and I support that fully. Yeah.
And I just also want to add to that. I think, on top of that, something that has been important to all three of us, or has maybe driven all of our designs, is being immersed in the experience. So of course it's important to hear from, your users on what they feel, but sometimes there are so many things that they can't explain, whether if they're in a place of trauma or they just don't know how to communicate it. And so I think being able to see those observations firsthand and get those insights is what also really helps. So you just have to be immersed in, the entire process and what is actually happening.
I think that's a really, really uplifting message, that we should dare to speak our needs and become better designers doing it, and making better designers around it. But also, as you say, Antya, we need to also be in the spaces where it's okay, and help creating those safe spaces around us for speaking about these topics. But on that note, I don't have any more time to ask you any questions. I think this has been so enlightening, and I think it's actually also been very tangible and very, very useful. I want to thank you, Iffat, Malene, and Antya, for being with me here today. From Asia, North America, and Europe, we're represented very, very well here. And I just want to thank you all, and thank you for watching.
Thank you for having us.
Thank you.
Luckily and thankfully, designs for women are on the agenda, and hopefully this trend will remain central to design from here on. Thanks for watching. And by the way, you can meet even more Index Awards 2021 finalists tomorrow at our pitch tank. See you then.